Hello and welcome back to my channel. My name is Cynthia and today I bring you my latest update for my twin pregnancy. I am pregnant with Dai twins and today I bring you updates from week 28 to 31, slightly falling into 32. I'm expecting them to arrive at some point in July, which is not far now. I have a fan in the background. Please forgive me if that makes any noise. I have some notes and I have my drink here. It's a heat wave in the UK. We don't get nice weather very often, so I'm not complaining, but it is a little uncomfortable carrying this big belly around in this heat. So please forgive me if the noise of the fan disturbs the sound of the video. We'll see. Week 28 was a very eventful week, and I actually thought I had gone into premature labor. Thank God that wasn't the case. I was having a lot of Braxton Hicks contractions, and it turned out that I was just dehydrated, and I had to take some paracetamol to keep them at bay. And I resumed taking some electrolytes. I take them, but not perhaps as regularly as I should. So thank God that was just a false alarm, and I was sent back home, and the babies obviously are still in my belly, so that was a really good outcome. At week 28 I had the glucose test, which actually wasn't so bad. So I just finished doing my glucose test for week 28. Oh, I'm starving. Oh, I'm really starving. It was not too bad. Basically, you go in there, they take tons of blood, and then you drink this thing, which is 50 grams of sugar. But it doesn't taste too bad, actually. It tastes okay, and I'm starving now, looking forward to going and eating something nice. I'm so hungry, and I feel a bit queasy, but all done. And I'm 29 weeks today. I enjoyed the drink, weirdly, but I struggled towards the end because I was feeling a little nauseous and a little sick. However, I did manage to stop at a lovely cafe in Honey and Harvey and had a lovely breakfast, and that made up for having to wait so long to eat. I also had a nice slice of cake and a coffee, which was absolute heaven. From week 28 I was also prescribed some blood thinning injections, and that is to keep the preeclampsia at bay. I haven't been diagnosed with preeclampsia, but because I'm at a high risk, I am over 35 and I'm also carrying twins, the doctor prescribed these injections, which I have to take every single day. They're really not enjoyable at all, but needs must, and I take it first thing in the morning until I'm 6 weeks postpartum. I don't enjoy it, like I said, but it is what it is. Symptoms for week 28: a lot of heartburn, the false alarm, a ton of Braxton Hicks, breathlessness is a common theme throughout this pregnancy from very early on up to right now, but it continues to be a symptom that I experience pretty much every week. That's week 28. Week 29 we have, I feel great. I just noted here, I feel absolutely great. So after having that roller coaster of emotions at week 28, week 29, I'm able to exercise again. I'm feeling good, not changing my symptoms. So a ton of heartburn, slight headache, which could also be from just not drinking enough water. I do try my very best. And I take some electrolytes. So yeah, hopefully managing. But the symptoms remain very much the same as week 28, the breathlessness, the heartburn. The babies are moving so much and their kicks are very strong, which is really lovely. I really enjoy sitting in the evenings and just feeling my tummy and how the babies move. For week 30 I was able to finish work, which I'm really excited about. I was really excited about because my body was telling me, yes, it's time to rest. I've been taking so many naps since then, so it's been wonderful to spend extra time resting and also with my baby, my 4-year-old. I'm also able to exercise this week, although I have to say one thing I noted down, and I think it's as a result of pregnancy, is I had to have a root canal for the first time ever, and oh my gosh, it's not painful, it's just an uncomfortable thing to have done. And for the first initial stages of the root canal, the dentist didn't want to put any adrenaline in the numbing, in the injection, in the anesthesia, I don't know what you call it, and I felt a lot of that, so that was not very comfortable. But as a result of pregnancy, I don't know if it's fact or fiction, but the baby seemed to take every single nutrient out of my body, and thus the teeth are suffering. Hopefully I don't need another one, because it's not something I enjoyed at all. Week 31, I have in here, what do I have here? Feeling good, heartburn, pelvic pressure, so a lot of that lightening crotch pain, which apparently is a good sign that labor is not too far and that the babies are down and they're engaging with the cervix. Both babies are head down, which is a really, really good thing. I'm exercising a lot. This week we took our 4-year-old to the Natural History Museum, and I managed to do a bit of walking around London, and it wasn't too taxing on my body. Again, I'm resting a lot because I'm no longer at work, so it's wonderful to be able to spend that extra time, and yes, it's great. Oh, I forgot to mention at week 30 I had a scan to monitor the growth of the babies. Baby A is tracking smaller, and on the week 30 scan he was 17% smaller than the baby girl, and he was catching up. On my last update he was only 12%, but for week 30 he was at 17 smaller, which, yeah, the consultant he's not keen on having that trajectory. He will worry for 25% discrepancy, but yeah, I had to have another scan at week 32. Okay, so what else for week 31? Okay, now week 32 I had an appointment again with I had a scan and I had a consultant afterwards, and I had to make the choice of birth that I would like. And having given it a lot of thought and weighing out the pros and the cons of each, a natural and a C-section, I think I'm opting for the vaginal delivery because the recovery is easier, and also because my consultant is highly recommending that I have a natural delivery, given the fact that I've had 3 previous natural deliveries without any complications apart from being extremely fast. I would like to avoid going into labor by myself, and I'd rather be induced, so we could be looking at the 14th, the 18th or the 21st of July, which is not long at all. In the UK, unlike in America, you get, well, I would get to deliver at a normal delivery suite, which is giving me a little bit of anxiety. I was expecting to deliver at the operating theatre, which meant a quick transition from vaginal to C-section. However, that is not going to be the case. My doctor or my consultant is not the one that's going to be delivering the babies, but the registrar of the hospital, which they probably do more births, so that's fine. But I'm just getting a little bit anxious about the fact that the delivery will take place at a delivery suite rather than an operating theatre. Could be a good thing because I really want to push these 2 out. I want to have them naturally, vaginally, like I have my other 3. But yeah, on the back of my mind, I'm a little bit nervous about the fact that the transition into a C-section could take longer than what I had anticipated. My doctor is going to give me a scan at week 32 himself, and he will be determining a date for sure. He's giving me 3, but depending on how baby A is tracking, he will determine when is best, if it's best to have a C-section or if it's best to have a natural, and by when. I definitely want to be induced. The sooner the better, although of course I want them to be cooked. Ideally would like to avoid NICU time, but wouldn't we all? So it may happen, it may not. We have to be prepared for either. I think it's a very high possibility that with twins you are going to have time at the NICU, which is can be stressful. After week 34, we'll have a last scan at week 36, where the final position of the babies will be checked. Hopefully they wouldn't have turned by now, or by then, because they're both head down in a good position for vaginal delivery. That is it for my updates. I hope that you find this useful. I know that there isn't very much on twins on YouTube, so I'm hoping that can help anybody else out going through the same thing and experiencing some of the symptoms I'm experiencing. And we'll see you in the next one, and take care. Bye bye.